Hi, my name is Nia, and today I'll be demonstrating how to insert a Foley catheter. So, one of the first things I'm going to do, I'm going to verify the doctor's order, and I'm going to gather my supplies. Um, Hold on, let me get some gloves real quick. 1 second. Gather my supplies that I'll need for the Foley catheter change, and I'm gonna have my gloves. And when I gather my supplies, I'm going to enter the patient's room. When I enter the patient's room, what I'm going to do is I'm going to provide the patient some privacy. I'm going to introduce myself to the patient. I just want to make sure to identify the patient with two identifiers, being name, first and last name, and date of birth. Uh, Now what I want to do is make sure to perform my hand hygiene. And while doing that, while providing my hand hygiene, I can provide the patient uh, with a little bit of education about the Foley catheter and the insertion, and also answer any questions that the patient may have. So ultimately, what I really want to do now is let them know that it's going to expose them a little bit when I pull back the blanket. But you just want to let them know that you're going to try to provide as much privacy as possible to the patient. Also, what you want to do is ask the patient if they have any allergies, because it's going to be some betadine and latex within the kit. And you just want to make sure that they're not allergic to either of those things before you use your kit to insert the catheter. So now what you're going to do after that, you just want to position your patient. The best way just to optimize the safety and his or her privacy. You just want to allow the placement of the patient, the position of the patient to easily allow you to insert the catheter. So once that's done, you're just going to place your blanket. It's going to be up here. You're going to place your blanket down towards the perineal area to allow a little bit of privacy while you're going to insert the catheter. So next, what you're going to do, you're going to assess the perineal area to see if it needs to be cleaned. If so, you're going to do that, clean the area with the proper technique. Then what you want to do is have the patient move their ankles up and to the side, so their legs be up in an upward motion, and they're going to bring their legs to the side. Once you do that, what you're going to do is you're going to have your kit here. This is your sterile field. What you want to do is don your hands with the sterile gloves once it's open. So right here, this is the sterile field. So I'll bring this to the side. So this is my sterile field. And what I'm going to do is I'm going to don my hands with the sterile gloves first. Oh, and before you do anything else, make sure you clean your hands again after you did the perineal care before you don your hands with sterile gloves. So I'm going to open this up. And I'm going to don my dominant hand first. These are usually a little hard for me to put on. I don't know why, but they are. I just think they don't like me sometimes. All right, so I have my hands donned and ready to go. So now what I'm going to do, I'm going to set that aside, put that in a proper receptacle. And you just want to make sure not to cross over your sterile field because it can break the sterility. But you don't want to cross it with your contaminated materials I just want to make sure you put those away. So next what I want to do is I'm going to take out my drape, and now I'm going to put that under the buttocks and the upper legs. So you might need to position your patient a little bit better. And once you do that, once you put the drape underneath the patient's upper legs and buttocks, what you're going to do next is you're going to place your fenestrated sheet over the patient's perineal area. Okay, and once you do that, once you have that sheet placed over that area, you just want to make sure that you're still keeping the sterility. You're going to place over the urethra. That's going to prevent, this sheet's going to prevent contamination. So once you do that, you're going to get your alcohol swabs, and once you get your alcohol swabs, you're going to open that up and place that down, and you're going to clean the labia. So you're going to clean one side of the labia with the alcohol wipe. Then you're going to get another swab, and you're going to clean the other side. And then you're going to also make sure to swab down the middle area of the vagina. So now once you're done with that, you're also going to get rid of that in the proper receptacle. And once you've done that, now what you're going to do is you're going to get your tubing out. Your tubing out of there. And what you're going to do, get that out. Make sure it's nice and properly put on. You're going to get your syringe, and you're going to attach it to the catheter. Place this in the proper receptacle as well. And once you have that, you're going to attach it to your catheter, and you're going to remove that sheath, and you're going to place this in the proper receptacle as well. So once you've done that, you just want to ensure that your balloon, he's going to push a little bit of the saline into the balloon, just to see if it'll pump up for you. And once you've seen that it'll pump up for you, now it's time to put your lubricant, which you'll find in your kit, onto the tip of the catheter. Now what you want to do is let the patient know before you insert the catheter, is let them know that that they may feel some pressure, while inserting the catheter tubing. So what you want to do is come over here with it, and you're going to insert that catheter into the urethra. And you're going to go all the way down in there until you get some yellow urine. And then once you get the yellow urine, you're going to make sure the tubing is inserted into the bladder. And now once you do that, you're going to, of course, pump up that balloon. And you're going to pump up that balloon with the saline from the syringe until it's full. So once you've done that, you're going to give the tubing a little tug just to make sure it is secure. And you want to make sure it's inserted in your urethra through the bladder as well. All right, so once you've done that, to ensure, you can remove the syringe. And you're going to place that in the proper receptacle as well. But for this video, I'm going to reuse this for later purpose. So once you've done that, you're going to tape the tubing. You're going to tape the tubing to the side of the thigh. And depending on the patient, it really depends on if you're able to tape the tubing on the thigh. Because if they are bedridden, or if they might end up with wounds or anything like that, if their skin is fragile, you don't want to tape the tubing to the side. You just have to find a different way to secure the tubing to the side of the thigh or to some other extremity. So now that you've done that, you're gonna label the catheter with the date, time, and your initials. And next, what you want to do is you're going to attach the bag that you have here to the bed. When you attach the bag to the bed, you just want to make sure that it's not attached to anything that can move around. I'm sorry. Whew. Make sure it's not attached to anything that can move around, because you don't want to risk the catheter being pulled out of the patient. So once you've done that, if you need a sample, what you can do is use this little cup here, and with an empty syringe, you're going to place it insert it into that catheter. I'm sorry. And when you insert it to the catheter, you're just going to pull back, and you're going to get the urine that you need, and you're going to insert it into the cup. So once you've done that, now you're able to place your syringe in the proper receptacle. And then once you've done that, when you want to remove the syringe, you're going to have an empty syringe, and you're going to use that to remove the catheter that's already inserted. So once you do that, when you want to remove the catheter, you're just going to use sterile technique and get another empty syringe to pull that liquid from out of the balloon. And then when you're done with that, you'll be able to remove the tubing from the urethra, since the balloon will be deflated. Usually it'll be around, it's capable of holding about 5 to 10. But now once you're done and the catheter is inserted, leave that here, try to let it stay. Once the catheter is inserted, what you want to do, wow, why won't it stay? My goodness. Guess it's the coiling of the bag. Let's see if that works. Once you've done, you're going to put your trash and your in the bag first in the proper receptacle. Take off your gloves, of course. Put it in the proper receptacle. Of course, not over the patient, but around the patient. And then what you want to do is perform some proper hand hygiene. And then you're going to return, make sure you return to the patient to return their bed to the proper position. You want to place the call light by the patient. And you also want to perform, you want to ask the patient, do they need anything as far as help to the restroom? And also you want to make sure those side rails are put up as well. And like I said, you want to make sure the patient doesn't need anything, or if she doesn't need or he or she needs anything, to let you know with the call light. And before you leave the patient's room, you want to make sure to document the procedure that has taken place. And after that, that is how to perform a catheter insertion. Thank you.